Ladies and gentlemen, welcome back to the channel. I'm Dr. Dawson, and today I decided to do something a little bit different. Normally I'm doing some sort of informational video about rabbits, about cats, dogs, diseases, all of those things, but today I've decided to do something a little bit different because one of the most common things that I get said to me, well, in practice is, well, I saw X on Dr. Pol. So I've seen Dr. Pol a few times, and so I thought I'd go and dive in a little bit to some of the things that are on the show. These are just a few short clips that I was able to find on YouTube, and I just wanted to react to them and maybe see how accurate they are from a veterinarian's perspective. And obviously, I'm going to be minimally critiquing how they practice their medicine, just because what's shown on video is not always the same as what actually happened. And so I just don't want to go after them too much. But the other thing to remember is that sometimes things have changed a lot since people have been out in practice to, or when they graduated from when I graduated. And so don't be too judgmental, even if I tend to be a little bit judgmental on some of the things they do. So let's get started.
Hello, puppies.
Dr. Emily has been called out to Chris's farm for a ballooning bovine emergency.
I'm coming out to Chris because he has a calf that's bloating and it needs help immediately.
So are you?
Ready to de-bloat a calf.
Yeah. I have a calf that's bloated, off feed. You can just see it's like an egg turned sideways in her gut.
Well, he is bloated.
Bloating is caused when foam builds up on top of fermenting food in the stomach, or rumen.
Come on, buddy.
Essentially,
That's not always true. It's not always foam. So there's a whole bunch of different types of bloat. Some of them are caused by pneumonia, affecting some of the nerves that go to the GI tract. But others are foam from eating an improper diet, or some of them are just ruminal acidosis is what we call it. And it's where the rumen becomes super acidic. And often that's going to be a free gas bloat, so there's no foam. It's just gas. And that one typically will happen because of an improper diet. They eat too much high protein. It'll kill some of the good bacteria in the gut, and it'll shift it to a really acidic pH. And that'll produce a lot more gas in their rumen, and a lot of times they won't be able to keep up with eructating. And as it expands, it actually will paralyze some of those nerves and make it really hard for them to burp out all that gas.
Essentially, blocking the release of gas.
Can he fit?
He'll fit.
It's very painful for cows and can kill them in as little as 15 minutes.
So typically, bloat doesn't kill cows that quickly. Typically, we have a little bit of time. Usually, if it does kill them that quickly, it's been going on for a significant amount of time. Now, I will say that I've seen cows die from bloat in a very short period of time, but usually that's a foamy bloat, and usually you still have probably an hour to 2 hours leading up to that.
With bloat, basically the rumen just keeps getting bigger and bigger with gas, and as it gets bigger, it actually starts crushing the lungs and they can't breathe anymore, and then they can die. That's some bloat. He looks like a blueberry. This is easily the biggest bloat I've ever seen, so he's enormous. He's as big around as he is tall.
I've definitely seen a lot of those most of the ones that I've seen bloated are about that big. Not all, but quite a few of them. So it's not uncommon when you have a bloating calf, especially that size, to see them really, really big.
He's got a little runny nose.
You want
Has
him
he
right?
got pneumonia?
I don't know.
He has mucus and snot coming out of his nose.
Dr. Emily spots another issue.
Yeah, he's got pretty rough sounding lungs. 103, 5, pretty warm, especially for a cold night. So between the fever and the harsh sounding lungs and the mucus coming out, it looks like pneumonia.
Yeah, a lot of times we do see, like I said at the beginning, sometimes we can see a bloat as a result of pneumonia. So yeah, definitely true. Very consistent with pneumonia. Pneumonia is very common in cattle in general. They react very strongly to a change in temperature, especially when they're stressed out. He's right around the size where he was probably weaned very recently and just put out into a feedlot or a backgrounding place. And so he's definitely a high risk for pneumonia.
On top of the bloat, this cow is suffering from pneumonia.
Okay,
Time for Dr. Emily to try to provide some relief.
it's a good place. We have to get the air out. Most long-term way to do it is to put a trocar in it, which is basically a really huge hollow needle that allows the gas to come out, and it's screwed into the animal's hide so it can't come out.
Yeah, this is definitely one of the ways that I treat bloat. She did have a hose with some mineral oil and stuff to begin with, and usually we recommend, you know, at least when I was in school, we'll usually at least start with passing a tube. This calf is definitely big enough. If they're a really small calf, sometimes we won't, but this calf is definitely big enough to pass a tube and see. If it's free gas, you can actually measure the pH of the ruminal fluid, and if it's really acidic, then if you treat that, a lot of times you don't end up having to go back and putting a trocar in. My guess is that this is looking like it's a little bit later in the day. She probably is just tired and doesn't want to come back if he starts to bloat after hours, which is fine, because no matter what, this trocar is not going to be a long-term issue usually. The only challenge is that sometimes a trocar, you're going to have a risk of infection. In the moment of trying to save them, this small of a risk is pretty minimal, and definitely a trocar is fine. But I definitely would have started with the tube. But the other side of that is that if you tube them, get all the gas out, and he starts to bloat again, now there's a little bit more gap between the rumen and the side of the body wall where you're going to put the trocar in, which means that if you poke in and don't get it right, then the rumen can be poked and some fluid can fall out of the rumen and into the abdomen, which is also a really bad thing. So 6 of one, half dozen of the other.
An incision into the skin, because otherwise you're not going to get through it.
I just had back surgery, so if this goes wrong, I'm out of here.
That's fair. That's fair. And then you just poke it straight through the muscle walls, the rumen wall, and then start screwing. Okay, you ready?
Yep.
A little pain for a lot of gain.
There's 2 things that I think that I would have done differently. It takes 3 seconds to shave, and it takes a minute to scrub it. You know, at this point in the calf where he's at, he's not foaming at the mouth, he's not ready to die. You should take that time to shave it, clip it, because then you're a lot less likely to get an infection later. The other thing is doing a little bit of lidocaine for pain. You're not going to eliminate the pain of it, because to get all of the muscles down there can be difficult, and you don't want to poke into the rumen with your syringe. So just even doing a little bleb under the skin before you cut, and maybe she did, who knows, but it doesn't look like it was shaved at all, and I definitely would have shaved it, just because it only takes a couple of minutes. Haha, that sound is
That'll
amazing.
work.
And
When she got in there, boy, you'll get...
as soon as you poke a calf like that, the gas goes down so quickly. They start to breathe better. They're so relieved that. So even though she did it the older way with no basically anesthetics or local anesthesia anyway, the relief is definitely there. And in an emergency like this, you know, you can kind of get away without doing all of that. But I would have taken the time in this particular case. But there, like I said before, there could be some things on here that they just didn't show.
Gas just come right out.
That should be some relief there, bud.
And you can tell he's feeling better.
Issue 1 is relieved.
How much do you think he weighs?
I was guessing 600.
Next, a dose of antibiotics.
That calf doesn't weigh 600 pounds, maybe 450. Whatever. The other thing is they're giving Draxin, which is a long-acting antibiotic. It is not really helpful in the case of if there was any leaking when they put the trocar in. There's always a risk of getting some ruminal fluid in the abdomen, and the Draxin's not going to be super effective at that. But it's really, really, really good for, you know, dealing with pulmonary issues or pneumonia. The other thing that I think would have been interesting, if she, we'll see in a second if she talks about it, but if she assumes that this bloat was caused by pneumonia, a lot of times a trocar isn't long enough. Being in for 3 to 4 weeks isn't long enough. You end up having to do what's called a ruminotomy. And a ruminotomy is where you surgically take a piece of skin about this big, so 2 to 3 inches in diameter. You cut that out, and then you go in and you suture the rumen, and you cut a hole in that and you suture it to the skin and leave a permanent hole there. And if it's due to pneumonia, a lot of times they'll continue to bloat as soon as that hole closes up again. And so you have to do something a little more permanent.
Antibiotics should help fight issue 2, the nagging pneumonia.
All right, let's see what he does.
Good to go?
Yep. Once everything goes down, then he will take the trocar out in like a week or so, and then it'll just heal back on its own.
Dr. Emily did an excellent job. Wait and see.
You gotta be feeling better. All right, is that all you got?
Unless you want to do herd health while you're here.
Sure.
There's 40 of them.
I mean, we could.
And that is the next most common thing that somebody says, well, you're here. That's also pretty common. But, yeah, so I think, she did definitely a good job. There's a few things that I would have done differently. Specifically, I would have clipped it. I would have done some lidocaine, at least through the skin. And then I would have probably tried to tube before we went to a trocar. And at least see. And, usually there's a specific smell with the gas from ruminal acidosis. And so if that is the case, then treating for that and not necessarily going to a trocar, which has a little higher risk of infection and things like that. Definitely antibiotics were indicated. And I would also probably put them on something that would be a little bit better for the possible complications of having ruminal fluid in the abdomen. So if you guys want me to do more of these videos, let me know down in the comments. Otherwise, I will be reviewing and kind of going through what to feed rabbits in my next video. And we're going to go through a whole list and decide which ones we should give often, what kinds of fresh vegetables, what types of fresh vegetables maybe should only give once in a while, and some of the ones that maybe you should avoid giving. So we will see you guys in the next video. Have a fantastic rest of your day, and we'll see you in the next one.